Have you ever thought about what happens in the hospital if you are unable to pay your bill? Hello, I am Kendra Hawley. I will be giving you information about why lower income families should have healthcare that is free and accessible. Growing up, I have always been passionate about healthcare and helping people. I believe that a person of a lower income status should have the same rights as a middle class or a high class income. I feel that your financial background does not make you less than or unable to get the care that you need. And in this economy, most people only think about raising healthcare prices to make a profit instead of finding ways to make it accessible and free for different social classes. The importance of my topic is to highlight the importance of lower income families struggling to meet their healthcare payment needs. Allowing healthcare access for lower income families reduces the stress put upon them to get the help without worrying about medical bills or treatment plans. Patients and families can focus on getting better. Through this, these lower income families can forget about the financial strain, improve the health outcomes, and have health equity, knowing that no matter what, they will be taken care of based on their financial background. Now, I would like to get into my 3 main points: reducing financial strain, improving health outcomes, and having health equity. I pulled a source from Well-Being and Stability Among Lower Income Families, a 10-year review of research, National Library of Medicine, published October 25th, 2020. It states, family well-being essential to smooth functioning of communities and societies. It's hindered when there is a high incidence of poverty. The poverty rate in the U.S. hovered around 14% before the enactment of the Personal Responsibility and Work Opportunity Reconciliation Act of 1996. Following welfare reform, the poverty rate started to decline. The decline was 11.3% in 2000. Although scholars have questioned the act to being the cause of the decline, uncertainties in the economy, including the 2008 Great Recession, caused the poverty rate to climb again and to remain around 15% in 2014. Even if you are to be employed, they are exposed to lower wages from $7.25 to $17.25 an hour, which makes it hard for them to survive. So when they are in need to be seen by a healthcare provider, they are scared to get declined and sent somewhere else. The EITC program was created in 1975. It is an extensive federal assistance program, lower income citizens to supplement their household wages and offset their Social Security taxes. I have another source, a quote from Health, Income, and Poverty. Where we are and what could help, Health Affairs, published October 24th, 2018. It states, EICT payment recipients experience significantly lower levels of perceived financial stress. The relationship was partly mediated by the less need to borrow money, lower levels of food insecurity, and fewer unpaid bills. This is similar to SNAP, another government help program. Next, I would like to get into my second main point, improving health outcomes. Lower income workers are most likely to be employed by organizations that do not offer benefits for healthcare. Less than 1/3 of the low income workers obtain healthcare through their employer, compared to nearly 60% of higher income workers. Low income communities are most likely to be obese or to have other health issues due to smoking, eating unhealthy food options, because they are struggling to maintain healthy options due to the prices. When they go to the doctor, they don't have insurance, so they are declined. which could spark illnesses and diseases due to the lack of habits they live with. Better healthcare would allow them the same access as high-class citizens. Social risk factors include race, educational status, sex, geography, and then ethnicity. Now to my third main point, health equity. A fair opportunity for everyone to obtain their optimal health. It is an advanced identify health disparities. Define specific and actionable goals of addressing any disparities identified and prioritize populations and communities that are historically underserved, including diverse patient perspectives in every phase, from development to implementation to evaluation. Health disparities are preventable differences that populations experience in the burden of disease, injury, violence, and opportunities. When people have limited access to health resources they need to be healthy, they are likely to struggle from health issues. Social determinants of health are conditions in which people are born or age influence health outcomes of the quality of life. To conclude, healthcare should be accessible for lower income families. They deserve to be seen and taken care of in their times of need and not ignored or decline healthcare services just because they are unable to afford their bill. Reducing financial strain allows low-income households to be helped with healthcare options, and with no insurance can seek the help they need from the government with health equity, which creates a safe space for them to have a fair opportunity improving their health outcomes. We can see the difference in different social classes and their effect. It's not good. It's not okay to ignore the fact that there are people out here, whether they're patients who need to be admitted or families who are looking for help, who feel they do not matter because they cannot afford the same healthcare access as others. In my life, I've seen family members and friends struggle to make a living, to afford healthcare, since America is built off of the idea of making a profit, to benefit people who can afford it. It's hurtful to know that they need help and they are turned down simply because of their financial background. My question to you is, are you willing to be the change that we need in healthcare? Thank you.